How do we deal with elderly patients? So you'll notice I don't have Andrea sitting right next to me. I've got Barb, just kidding, Barb, sitting with me today, and we're going to chat about how do we communicate differently? What do we need to do different when we're dealing with a special population? It's not just about treating a tooth. It's about treating an entire person, an entire patient.
Sure.
Because if you think you're just treating a tooth, you're going to miss the big picture of it, which again works really well with what we want to talk about today. So you wanted to chat about communication and communicating with an aging patient. What thoughts do you have there?
My question is, do we treat them as if they're going to die? Or do we treat them as if they're going to live? And do we put our own filters on them? And what are we really doing with them? Are we really being honest? Because they have very special concerns. And their concerns can vary as far as their lower pH in their mouth that deteriorates root structure faster. Their needs can be complicated because they might not have the mobility in their hands. They might not be able to hear as well. They might not be able to see as well. So do we take the time and talk to them slowly? Do we explain treatment very simply, very easy? Lots of stuff.
So you, it sounds like, want to illustrate some of this as you want to handicap me.
I do, and for you watching, when you get done with this video, try this in your office with your team and role play, because Darren's going to put these cotton rolls in his ears, and then we're going to cover his ears with a little headband, because older folks can't hear the way you and I can hear. So he's going to cover up, and I'm just going to maybe ask him a couple questions and see if he can hear me.
This is going to mess up my hair.
I'm purposely going to talk a little bit lower to see the kinds of responses that it takes patients a little longer to hear, a little longer to understand. So, Darren, you've come to see us, and there's really a lot going on in your mouth, and there's a lot we need to address. You've got some root issues. They're wearing away. We want to do some fluorides for you, and we want to present some treatment to you. Can you hear me all right?
Sorta.
And what part can't you hear?
I can do well as long as I can see your lips and read them at the same time. So if you're wearing a mask, this might be a problem.
Okay, so I'm purposely going to take my mask off, and if you could watch my lips and just put your hand up if you lose me, okay? So that's kind of what I want to illustrate. You know, if we treat our patients like and responded like they did when they're 20, 30, 40, 50, 60 even, and continue at this pace that I'm talking now, we'll lose them. You know, we've got to slow the pace down. We have to listen. We've got to kind of put ourselves in their mindset, which is they're here for treatment. They want to hear what's wrong, and they want to hear how to be fixed. But our job really is to do it as simply and easily for them as possible.
You know, it brings up a lot of interesting points, and not having done that before, I mean, I've worn earmuffs if I'm out at a shooting range or something. You know, it's sort of fascinating feeling handicapped like that. And for those of you that are skiers, another great metaphor is if you come out skiing with me in a snowstorm and it's flat light, I'm used to it. I can ski in flat light. I can see just fine, and it doesn't really slow me down too much. But those of you that aren't used to it, you might find it to be a pretty massive challenge to be encumbered by that. And then you take and you combine that, and anyone who's been around us long enough knows that we talk a lot about distraction. Put some earplugs in, put a blindfold on, or saran wrap over your eyes, or something goofy. Have some fun with it, and lead each other through the office, and kind of go through that whole process. And you know, I think you might find it to be very educational about how we should be careful with anybody who has any sort of a challenge, because I think we take it for granted, and we just go 100 miles an hour, talking 3 times faster than we're used to, maybe because we're nervous. And we don't realize how challenging that is. I hope you've enjoyed our content today. I want to thank Barb and Dr. Dave Matty for taking me out to Louisville so I could be around the dental students. It was a blast. And if you have questions or concerns, get with your coach, talk to them about whatever your issues might be. If you got other requests for TV shows, certainly do let us know. Otherwise, thanks for joining us today. Have a wonderful day, and we'll see you next week, 8 a.m. Mountain, 10 o'clock on the East Coast. Until then, have a wonderful day. Bye-bye. What if you could have the practice of your dreams? What's holding you back? Imagine a life where you have everything you ever wanted.